Welcome to Fundamentals of Public Policy and Analysis course. In my previous lecture, I discussed population policy, various aspects, and also told you that in this course we are going to discuss several policies. Next policy which we are going to discuss is National Health Policy. In this lecture, I will explain evolution and main highlights of national health policies, and then we will discuss the latest National Health Policy 2017, its main principles, objectives, key targets, and role of the Government of India in preserving and promotion of public health. We will also discuss the historical trend of various health indicators across Indian states and what are the key issues and challenges facing the country related to implementation of national health policy, and at the end we will sum up the topic. Let us first know what is health policy. According to World Health Organization, health policy refers to decisions, plan and actions aimed at achieving specific healthcare goods within a society. An explicit health policy helps define vision for the future, set priorities and expected role, build consensus and inform people. The United Nations Human Development Reports asserts that medical care is a right for all people. It means that there should be universal healthcare system in different countries. National health policies, strategies and plans provide a framework for addressing the complex issues related to healthcare, including non-communicable disease and also the Millennium Development Goals. In fact, is a very important subject, and health is a state subject, and most of the programs and policies are formulated by the state, but central government plays an important role by formulating the national policies and developing national programs which are implemented by the states and below the state at the local level by panchayat and municipalities, and the national policy also promote coordination among the government, health and development partners. There are several stakeholders in the healthcare services. So coordination among these healthcare services very important, especially civil society, private host sectors, and government sector. They have to work together in order to achieve the policy intended goals and objectives, so that the available healthcare resources may be efficiently utilized and the delivery of healthcare services to the last man may be effectively done. Policy also ensure equitable access to quality healthcare and improve long-term health outcome for all. So the national health policy also envisages equitable access to quality healthcare and improve long-term health outcome for all, because there may be huge gaps between sectors, regions, as well as the social groups, economic groups. So the main objective of national health policy is that these discriminations should be addressed and universal healthcare services without any discrimination, equitable access to all services be made to all members of the society. Let us now have a look how the national health policy evolved in India. As I told you that health is a state subject, and states also formulate programs to address the healthcare issues of their citizens, but central governments in India also play an important role by formulating various programs, policies, etc. Before independence, 1940, a Bhor committee was constituted, and it was a very important committee, and the report is very comprehensive, and this was the first attempt towards addressing the healthcare related issues in India, and it also ensured that every member of the society should have access to the healthcare services, means universal healthcare system should be followed, and it provides actually the foundation of public health here. In 1950s to 60s, during the first to third 5-year plan, more focus was given on disease control, malaria, TB control. Technocentric approach was followed during this period. Then in 70s, fourth and fifth plan, the focus was more on addressing the issues of health in rural area, and minimum need program, sanitation and family planning program were initiatives. Then in 1980s, National Health Policy 1983 came. So this was actually the first healthcare policy in India, and its focus was on providing primary healthcare services to the masses, and its focus was on preventing healthcare. Decentralization of healthcare services was also discussed. Then in 90s, 8th and ninth plan, focus was on equity and reforms in the healthcare sectors, and it addresses the issues of vulnerable groups, and policy integration was also addressed. Then second policy on healthcare services came in 2002, and this policy had the emphasis on accessibility of healthcare services to all member of the society, and it also addresses the issue of equity, and also ensure the role of private sectors in providing the healthcare services. Then during 2005 to 12, National Rural Health Mission was started in 11th plan, and the entire focus was on producing various schemes and programs to address the healthcare issues of rural area. ASA workers, maternal and healthcare, child healthcare services were addressed. Then in next 5 years, 2012 to 15, in 12th plan, the coverage was universal healthcare services coverage, and the main focus was to reduce out of pocket expenditure and improve the access of public healthcare services. In fact, health out of pocket expenditure is the major issue, because due to lack of effective public healthcare services, households spend lot of money from their own budget, and that make them impoverished, because in case of fatal disease like cancer or similar kind of other costly treatment related disease, people spend lot of money, and they may be more vulnerable to poverty due to this burden of disease. So therefore, in 12th plan, the emphasis was given on how to reduce out of pocket expenditure. And in the last, we have a comprehensive National Health Policy 2017, and we will discuss in detail this policy, which focuses on preventive, promotive, and universal healthcare services. As I told you earlier, so far, three national health policies have been formulated. First was in 1983, second was in 2002, and third was in 2017. So we can also discuss key aspects of the first two policies. One is 1983 policy, whose aim was to achieve the goal of universal health care services that is affordable and as per the need of the people. So, depending upon the people's demand, the healthcare services should be provided and it should be universal without any discrimination. Every member of the society should have access to healthcare services. It also emphasizes on preventive, promotive, and rehabilitative primary healthcare services, decentralization and community participation, and increased role of private investors. But it also has some limitations, especially related to selective healthcare, increased privatization, and dealing with the ground realities. So, excessive importance was given to the privatization of healthcare, and ground reality was delinked from the policy framework. Then comes to National Health Policy 2002. Its objective was to achieve acceptable standards of good health of Indian population. Decentralization again was emphasized in this policy, equity, accessibility of health services, and provision of affordable health care services, particularly primary healthcare services. So, primary healthcare services should be affordable, accessible, equitous, decentralized. These are the main highlights of these policies, and this policy also ensure the role of traditional medicines in healthcare services like Ayurveda, traditional Indian medicine system. Then the latest policy 2017, its main emphasis was that over a period of time the changes of disease have also observed. Earlier the main focus was on communicable disease, although still exists, but today the growing burden of non-communicable disease is rising, like diabetes or heart related disease or lifestyle disease, emergence of healthcare industry, and now healthcare itself becomes an industry, and expenditure is growing fast, both public as well as private sectors expenditure on healthcare services, and country is also growing at a relatively higher growth. So, economic growth, growing expenditures, and healthcare developing and industries, and rising non-communicable disease. These are the new changes that have been observed in recent years, and the National Health Policy 2017 should address these issues. The aim of this policy was to inform, clarify, strengthen and prioritize the role of the government in shaping health system in all its dimensions. So, in totality, the healthcare services should be provided, and its goal was to attain the highest possible level of health and well-being of all at all ages. And main objective are universal health care, trust in public health care system. This is also the important issue, because most of the people, they did not have trust in public health care services, especially at the lower level primary health care services, etc., and people were preferred to go to the private doctors or private nursing home where out of pocket expenditure is quite high, and therefore this policy emphasize that the society or people should have trust in public healthcare services, and it aligns with the growth of private sectors healthcare with public healthcare goals. So there should be a proper integration between the private sectors and public healthcare providers, and emphasis also on public private partnership in healthcare service sector. So now we can discuss in detail the latest policy after briefly reviewing the three healthcare policies, and this policy actually provides framework for preventive, promotive and universal access to quality health services. So preventive is very very important because prevention is better than cure. So if we can create such kind of environment through creating good environment, providing safe drinking water, sanitation, and many other primary healthcare services, then we can prevent the disease. So preventive, then promotive, and then universal access to quality health services are the main objective of the National Health Policy 2017. It also envisages that healthcare should be made universal, and it should strengthen the existing healthcare systems and also shift from curative to preventive health. So instead of spending lot of money on creating means emphasizing on curative measures or treating patients, it is better to prevent the disease. This is also the important objective of the national policy. The policy also highlights four fundamental changes since the National Health Policy 2002, and these are growing burden of non-communicable disease and some infectious disease, emergence of a robust healthcare industry, growing catastrophic expenditure due to out-of-pocket health care cost, leading to poverty and vulnerability to poverty, and rising economic cost, enabling fiscal capacity. So these are the four key trends that have been observed in Indian economy. First, that the nature of disease is changing from communicable to non-communicable, and burden of such disease is increasing. Then out of pocket expenditure is also increasing due to catastrophic expenditure, and that leads to poverty. And at the same time, Indian economic growth rate is increasing, and even if the GDP and tax ratio remain constant, the country is able to get more tax revenue, and due to fiscal capacity of the governments, more investments in the public sectors on healthcare services is feasible. This policy envisages decentralized execution, evidence-based planning, digital health, and transparent governance mechanisms to make service delivery more efficient and citizen centric. This policy is based on few principles. Let me briefly discuss them. First is professionalism, integrity and ethics, equity, affordability, universality, patient centric and quality of care, accountability, inclusive partnership, pluralism, decentralization, and dynamic and adaptiveness. So these are some of the principles on which this policy is based. For example, it focuses more on following the professionalism in delivering the healthcare services, and it also focuses on medical ethics, integrity, and equity means every member of the society should have equitous access to the healthcare services. Affordability principle means that the cost of medical services should be affordable, and due to this, government of India also started generic medicines which are much cheaper than the patented medicines. So affordability is another. Universality means that it should be having wider coverage, patient centric and quality of care. So the delivery of healthcare services should be patient centric, and emphasis must be on quality of healthcare services, accountability of government as well as private sectors, and there should be partnership among different stakeholders. Pluralism means that there may be different options available to the patients. There may be allopathic, Ayurvedic, Unani, or homeopathy, or different kind of healthcare system should be available. Decentralized means that healthcare system should be decentralized, starting from bottom to top approach, and role of public institutions like panchayati raj institutions or urban local bodies becomes very very important here in catering to the need of healthcare services of the people. Main objective of this policy are universal health coverage, free and compulsory primary healthcare services, access to and affordability of quality secondary and tertiary healthcare services, and reducing out of pocket expenses. So, first objective is that healthcare service should be universal. Primary healthcare services should be provided free to all, and as far as secondary and tertiary healthcare services are concerned, their access should be easy and affordable to the patients. And another focus is on reducing the out of pocket expenditure, which is quite high, reinforcing the trust in the public healthcare system by making it predictable, efficient, patient centric, affordable, and effective. Okay, so and third is aligned with growth of private sector care with public sector goals. So public sector has several goals of health, and private sector's activities should be aligned with these goals, so that through private sector investment in healthcare services may be useful in achieving the public healthcare goals. Main features of this policy are: first is focus on preventive and preventative healthcare. Second is universal health, strengthening the primary healthcare system, a gradual increase in public health expenditure. In fact, government is targeting to increase the public health care expenditure from the current 1.4% of GDP to 2.5% of GDP. Affordable and quality healthcare services to all, promotion of digital health and new technologies. These days, now digital medical is becoming very popular, and online prescriptions, online telemedicine, all are the important aspects of the public policies. Public private partnership is being promoted through this, and policy support is like Ayushman Bharat. This is a very good program initiated by Government of India, and 5 lakh insurance cover for medical is given free to the people under this Ayushman Bharat scheme. Let us know what are the key policy target. First is increase life expectancy at the birth from 67.5% years to 70 years by 2025. Then reduction of total fertility rate to 2.1 by 2025, and that has been achieved. Reduce under 5 mortality to 23 by 2025, and MMR to 100 by 2020, and that has also been achieved. Reduce the IMR to 28 by 2019. Reduce non-natal mortality to 16, and stillbirth rate to a single digit by 2025. Increase utilization of public health facility by 50% by the end of 2025. More than 90% of newborn babies to be immunized by 1 year of age by 2025. Family planning needs must be met above 90% of the household by 2025. 40% reduction in the prevalence of stunting among the children under 5 should be targeted. Raising public expenditure to 2.5% of GDP from the current level of around 1.4%. Increase state public health expenditure more than 8% of their total budgetary expenditure by 2020. That is also the important, because health is a state subject, and state must spend more on healthcare services. So it was targeted that 8% of their budget must be spent on healthcare services. 25% reduction in households facing catastrophic healthcare expenditure by 25, and establishment of health information exchange and national health information network by 2025. So these are the important targets, and some of the targets have already been achieved by the 2025. Although in this policy there is no specific mention of the last or duration of this policy or when the policy will be ended, but most of the targets set under this policy are 2025, and it envisages or it is presumed that a new policy need to be formulated after 2025, because most of the targets set under the policy are related to either below 2020 years or up to 2025. Let us now also know what are the policy outcomes. There are few points which we can discuss here. First is about 50 crores households health insurance cover of 5 lakh per family under the Ayushman Bharat PM JAY to reduce out of pocket expenditure. This is one of the important achievements, that Ayushman Bharat is a wonderful scheme because it ensure 5 lakh per family expenditure under the scheme, and obviously that will have some effect on reducing the out of pocket expenditure of households. Second is operationalization of more than 1.7 lakh health and health and wellness centers. These centers have been set up, or the primary health centers were moderated to improve primary health care services. Doctor population ratio is now 1 to 811, means that there is a one doctor per 811 population, and WHO target was one doctor per thousand. So we have also achieved this WHO target regarding the doctor. The MMR decreased from 130 in 2014-16 to 93 per lakh live birth in 2021. Infant mortality rate decreased from 39 per thousand live birth in 2014 to 27 in 2021, and over 10,000 Jan Aushadhi Kendra have been opened to provide generic medicine at 50 to 80% lower prices, and that will also further reduce the out of pocket expenditure of households. Role of government in preservation and promotion of public health. Here Ministry of Health and Family Welfare is responsible for making healthcare programs, disease control and family welfare initiatives. It undertakes research, provide technical assistance and fund for controlling of seasonal disease outbreak and epidemics like COVID-19 pandemic. It is responsible for the implementation of World Bank assisted programs like control of malaria, tuberculosis, AIDS and others, and it has major missions like National Rural Health Mission, National Urban Health Mission, and now it is known as National Health Mission. Initially there was National Rural Health Mission, then National Urban Health Mission. Now it is called National Health Mission. Swachh Bharat Abhiyan. This is also the wonderful program, and it has made significant contribution in reducing the disease or achieving the preventive measures in this regard, because it addresses the elimination of open defecation. Then Jal Jeevan Mission is another important areas where access to safe drinking water is provided. So water and sanitation, these are the two important indicators of health, because waterborne disease are very important, and the burden of disease due to poor sanitation water is quite high. So this is also the good initiatives taken by the government. Then Amrit 2015 aimed to reduce the expenditure incurred by patient on treatment of non-communicable disease. Ayushman Bharat I already discussed, and it has been observed that India is having a problem of pollution and environmental degradation. World Bank in 2013 report on India's cost of this environmental degradation in terms of air pollution, indoor air, outdoor air, water related, soil health, all these things. and World Bank estimated that India is costing one around 5.8% of GDP due to different form of environmental degradation. So when the focus of the government is on addressing these environmental degradation, water access to majority of people, total sanitation, all these have important implication on health care system of the country, especially having the preventive measure of health care system. Historical trend across Indian states. This graph is taken from a study by Das et al. 2025, and this shows about the infant mortality rate across different states, and that clearly shows that over a period of time the trend shows from National Family Health Survey 1 to 5 that the infant mortality rate is declining. In fact, infant mortality rate is a good proxy for healthcare services. So over a period of time in all the states the rate is declining, but there is a huge interstate variation in terms of magnitude of infant mortality rate, and that provide a important implication that state specific initiatives must be taken to address the issue of healthcare services. For example, Kerala and Tamil Nadu perform best in terms of healthcare investment, education, literacy, effective rural health systems, village health workers, and drug procurement reform. While there are some states which show some improvement, like West Bengal shows steady improvement, UP, MP, Chhattisgarh still lag, Manipur shows recent decline despite earlier gain. So there is a interstate variation in the healthcare indicator which need to be addressed by the policy. Let me now identify few challenges before the policy. Some issues are very important. First is failure to meet 2.5% of GDP public expenditure and high out of pocket expenditure. So this is one important issue. Although the National Health Policy 2000 set the target of raising the public's expenditure on health to 2.5, but it has not yet reached. So is the out of pocket expenditure, which is approximately 39.4% of the total expenditure of the household, or reliance on private sector. So corporatization and commercialization of healthcare also created certain issues, because the affordability of such kind of private sectors to the majority of people is not possible. So lack of a legal binding right to health. So in fact, ultimately a country should have right to health, means it should be a right, and so that affordable and quality healthcare services should be made a right of each member of the society. Lack of a roadmap to address the shortage of doctor, nurses and specialists, especially in rural area, still we do not have good doctor, nurses and specialists. So in this regard the digital humanities can play the important role, and the online prescriptions and online uh, medical care services may be promoted. Weak regulatory framework, especially controlling the functioning of private sectors healthcare, because this price and quality of healthcare services is a major issue in case of private sector. In fact, these two things, one is education, which will be discussed later on as a policy, and other is the health. They are the important things, merit goods, which should be provided to all members of the society. But privatization of both are creating more burden on common masses, because the costly healthcare services are not affordable to majority of the people. This is also the important issue. Then inadequate attention to the environmental degradation related burden of disease. So policy does not address explicitly the issue of environmental degradation. As I told you earlier, that World Bank estimated 1.8% of India GDP is the cost of all form of environmental degradation, and these days they are increasing day by day, and due to air water pollution, the burden of disease is also increasing. So this should be addressed. Pandemic preparedness, environmental degradation, digital health integration are the key concerns which need to be addressed. Poor data and health information system. So India needs to have a robust data information system. Rising burden of non-communicable disease and early diagnosis and effective management are still not adequate, and there is also rural urban gap with shortage of infrastructure and specialist services, especially in the rural area. So these are some of the important challenges which need to be addressed. Probably the new health policy may take up these issues and challenges the India is facing. So now let us sum up this topic. National Health Policy 2027 provides a strong foundation for improving health outcome through a preventive, inclusive and people-centric approach. India's health policies aim at universal health coverage and well-being but face several challenges like resource constraints, regional disparities, implementation gap, rising non-communicable disease burden, and weak healthcare data systems. Then strengthening regulatory and institutional framework, transparency and accountability mechanisms, and evidence-based decision making are crucial for translating policy intent into the policy outcomes. And finally, we need a coordinated, evidence-based and well-governed approach to achieve health related sustainable development goal and sustainable outcome. And now different countries including India are focusing on achieving the sustainable development goal by 2030, and many aspects of sustainable development goal are closely related to health, poverty, inequality, women empowerment. So we need to rigorously target sustainable development goal, and they should be properly integrated with national population policy goals and objectives. So with this, thank you and all the best.